Mr. Chairman, dear ladies and gentlemen, thank you very much for your kind invitation to join you in today's conference. With this conference, you are giving the starting signal for a total of 15 events of the associated program initiated by the Federal Ministry of Health within Germany's presidency of the Council of the European Union. And this is, I have to stress so far, the only one. This is purely digital. We are very happy to have you on board. I would like to congratulate you on your excellent program and thank you for taking up one of our focal points of the German EU Council presidency with your conference, the European Health Data Space. Having taken over the presidency on the 1st of July 2020, it will of course not surprise you that our presidency has not quite turned out the way we had originally planned it. The COVID-19 pandemic has changed a lot, both in terms of organization and in terms of content. We had to significantly rework our priorities. The red thread of the 13th German presidency are, of course, the lessons to be learned from the COVID-19 pandemic. Besides our aim to strengthen our preparedness for any future pandemic, we will focus on securing the availability of medicinal products within the European Union, and we will work on strengthening the role of the European Union in global health. One thing that had been on our agenda before COVID is digital. We plan to enhance digital health and work towards a European health data space. With the European health data space, we mean a common policy area with a joint understanding on rules and principles governing the exchange of and access to structured health data in the European Union for different purposes, especially healthcare, research and innovation. This topic has become even more evident and urgent, of course, with the COVID-19 pandemic. The interoperability of the corona tracing warning apps to ensure their respective use in different member states is a very good and a very clear use case to illustrate the added value of a European health data space. We launched, as you all know, the German Corona Warn app on the 16th of June 2020, and it has been downloaded by more than 17 million people so far and became one of the most used corona tracing apps in the world. The COVID-19 pandemic is becoming a catalyst for digital health transformation in Germany and the world because, probably for the first time, it became obvious for the broader public how digital health can help to improve access to healthcare. That is what Minister Jens Spahn is always stressing. Digital health will not fly because we just want it, but because people will realize that it really helps them in their everyday life. We need to demonstrate its added value to each individual. We have learned from the COVID-19 pandemic that epidemiological data is indispensable to fight cross-border health threats. A lesson we can learn from this experience is that a situation should not persist in which divergent national rules, divergent infrastructures and the lack of interoperability hinder EU-wide cross-border access to and exchange of health data. Despite the EU-wide legal framework that is set by the General Data Protection Regulation, there are, and we all know it, obstacles that hinder the processing and the exchange of secondary health data between member states. One reason is that the General Data Protection Regulation foresees extensive room for maneuver when it comes to the processing of health data. And rightly so. After all, every health care system is a data processing system, as we all know. Every member state has developed its own ways and rules when it comes to processing health data. These rules are relevant for the management of the health care systems, but at the same time, they do not necessarily facilitate the cross-border exchange of health data. This obstacle should be removed to the extent possible to increase the competitiveness of the EU in all health areas, namely healthcare, research and innovation. We are grateful that Commission President von der Leyen has tasked Commissioner Stella Kyriakides with the establishment of a common European health data space. This task came at the right time, considering that all member states were already adapting their secondary health law to the GDPR. Over the last 6 months, we have co-chaired a series of important workshops with the European Commission to look into the nuts and the bolts of health data use in the different European member states. 5 workshops were held between January and June 2020 with broad participation by experts, representatives of member states, of course including ministries of health, public health authorities, e-health agencies, as well as data protection supervisory authorities, stakeholders from the health sector and European institutions. The aim is to come up with concrete elements such as a European Code of Conduct, as well as a joint action to set out the European health data space. The final report, scheduled for this month, for September 2020, will also include expert reports at country level, as well as case studies to illustrate GDPR implementation in different regulatory frameworks and its impact on the use of health data. Germany is committed to tackling new challenges and reconsider the health data governance at European level in the interest of all citizens and patients in Europe. And this is a very important point to be stressed. We all know that health data is crucial for healthcare in general, but especially for personalized medicine and for the diagnosis of rare diseases where extensive health data is necessary to get the relevant information necessary for diagnosis and treatment of an individual patient, and of course to fight a pandemic like COVID-19 and to be better prepared for future challenges. The question how this could be done in concrete terms will be addressed here at your conference, and I'm very happy about that. The timing is well chosen, as we are indeed starting political debates on exactly these questions and are delighted to receive your input and your further input for our consideration. I'm impressed how many different players, from universities, hospitals, research institutes, pharmaceutical and medical technology companies and startups are participating in your conference today. This is gratifying because the European health data space as a common policy area is not shaped solely by the European Commission or by the Presidency or by member states, but by all of us. It must be brought to life through the cooperation with and shaping by the stakeholders. Everyone can make a good contribution in their own field. We encourage all relevant stakeholders to draw up consistent European Code of Conduct for their respective processing situations in order to establish a uniform interpretation and application of the GDPR in the respective areas and to facilitate GDPR-compliant cross-border data use in the European Union. With your conference, you are making an important contribution to stimulating discussion and involving stakeholders in this topic of the European health data space. We are very much looking forward to your ideas and your suggestions. I'm delighted that we are jointly starting this endeavor, shaping the European health data space and illustrating the added value of GDPR-compliant health data use for everybody. After all, better use of health data can lead to better healthcare and thus, at the end of the day, to be honest, can save lives. This is a message we need to convey also to critics who still believe that health data should remain in silos and in a safe room and not to be accessible also to researchers. We need to dare to share. This is an important principle. The value of the European health data space will also be a central aspect of our high-level conference, the Digital Health 2020 EU on the Move, in Berlin on the 11th of November 2020. We want to tell a true-to-life story of how patients can concretely benefit from data use and artificial intelligence applications on their journey through the healthcare system. We will start AI applications from which patients and consumers can benefit at home, discuss AI applications by healthcare providers and in hospitals. Like the Scanbalt Forum does, the Ministry of Health will stream its high-level conference in November live. Let me use the opportunity to invite you all to join us in our digital conference online. You can find more information on the website of the German Ministry of Health in due time. Let me at the end summarize that we are looking forward to work hand in hand with all of you to ensure that Europe takes the lead for trustworthy, science-oriented and value-based health data use on national, regional and global level. That way, we make a contribution to the competitiveness of the European Union's health systems, research institutions and last but not least also its health industry. However, this can only be made possible, again, if we dare to share. Ladies and gentlemen, thank you for joining us on the road to a living European health data space. I wish you an interesting, constructive and instructive, productive conference. Thank you very much.